Hey everybody, this is Dr. Adam Renee and welcome to the next episode of the One Thing podcast. In today's episode, we speak with Dr. Teray Garchitorena Kunishi, who is a naturopathic physician based in the San Francisco Bay Area, who has a specialty in mental health. In this episode, we dive into different aspects of mental health disorders such as neurodiversity. If you're listening to this episode, it is highly likely that either yourself or someone you know has been given a mental health diagnosis. While it's helpful to receive a diagnosis to provide some context and construct to dealing with a mental health problem, it also can be frustrating for the person and the family dealing with this diagnosis because it can limit the person and give them certain labels that may give certain expectations on what the future outcome is for them. Give some context on the complexity of mental health diagnoses. It is important to understand how a diagnosis is made. So psychotherapists, psychologists, and psychiatrists use something called the Diagnostic and Statistical Manual of Mental Health Disorders, also known as the DSM, to formulate a criteria to predict a mental health diagnosis. So this manual first came out, the first edition came out in 1952 and had over 106 different mental health conditions outlined. And the criteria to receive a diagnosis was formulated in that manual. This has grown. Now in the fifth edition, there's over 300 diagnoses of mental health conditions. So a provider will use this to determine and effectively diagnose an individual with a mental health problem. Dr. Teray, in our discussions, dives into something that's more considered like a continuum of mental health diagnosis and how in certain cultures in the world, receiving a diagnosis of a condition such as schizophrenia may lead to a different support structure and a different outcome than in a Western society. This is a controversial subject because mental health disorders really rely on a continuum. On one end, there can be a mild case or someone who's more integrated into the community, into the culture, and then there can be extreme cases where severe presentations of a mental health disorder may limit integration into society. So it's really important as we listen to this podcast that we determine the view of anybody with a mental health disorders from mild to moderate to extreme, so that we don't jump to conclusions and sit along the continuum and be able to see the view of a mental health condition from various perspectives. Let me just go into a little bit more about our guest before we dive into the episode. Dr. Teray received her naturopathic medical degree from Bastyr University, and she has a practice in the San Francisco Bay Area. You can find more about her practice if you go to deeplyhappy.com. She is a creator of something called the Deeply Happy Expert Series, and she's licensed in California and Hawaii for naturopathic medicine. She also is certified in hypnotherapy and something called neuro-linguistic programming. She's a very special person, a very special doctor, and I think you'll enjoy hearing her thoughts on mental health. So without further ado, welcome to the next episode of the One Thing podcast. At the conclusion of the episode, I'll share some final thoughts. Dr. Teray, welcome to the One Thing podcast.
Thank you so much for having me.
You're welcome. We were just talking offline here just about how long it's been since we saw each other. It goes back to, I think, 2007. And I was excited to get a chance to speak with you today. I remember when we were medical students together that every time you would speak up, there would be some sort of a silence in the room. Everybody wanted to hear what you had to say. You've always had that quality of having such a strong voice and clear about who you are. And I think it really has been something I've appreciated from you about you.
Thank you. Thank you.
Yeah. So why don't you give the listeners a little bit of insight onto your current background and what you're up to these days?
Sure. Well, as just like you, I'm a practicing licensed naturopathic doctor. I'm in California, and my practice focus from the get-go has been on mental health and all the things that are related to that. Obviously, as naturopathic doctors, we see how we don't focus simply on the mind, but on the whole person, and that includes, your well-being and your gut and your how you're living your life. Um, but something that's also been really important to me is, I went through a period of depression myself, and one of the things I learned about it was that it can be, and I wouldn't generalize this to everyone, but there's a lot of potential in, a different mental state other than, just being like happy and cheerful and like thumbs up. But there can be a calling in in every change that comes to us. And since my focus is on mental health, whether it's depression or anxiety or even things like schizophrenia and bipolar, can be unique moments for us to have insight that we otherwise would not have. And so there's always this interesting balance of, okay, this is a distressing mental state, and let's try to, help you through it in a way that's comfortable and you come out the other end. And at the same time, let's recognize there might be value in this. There
Mm-hmm.
might be a message in this. And that's something that I've been exploring in my own studies, but also with my patients and also with people I interact with through my newsletter and things like that. About it. How do we shift from a culture that is simply pathologizing anything other than productivity to something that welcomes a wider range of being, and what more can we gain as a culture when we do that?
Mm-hmm. Makes a lot of sense. So where where's the line between when someone needs help that is sort of addressing sort of the acute issues related to mental health versus um, putting it into a context or learning how to live with it?
That's a great question. And the thing is, right, as you know, we all need help all the time, every day. The individualism is a nice concept and it can work, but the truth is, as humans, we are an interactive species. We are social. And it's not a and or, but it's a yes and so there's a great film actually that explores this beautifully, called Crazy Wise. I'm not sure if you've heard about it. It came out last year, and it talked about how, there's certain tribal, not all, certain tribal societies or agricultural societies or even hunter-gatherer tribes that are still with us on this earth now, when somebody has unusual psychological symptoms like fainting spells or hearing voices or seeing things that others are not seeing, they are taken under the care of someone who knows how to navigate that. So sort of an elder or another shaman who can say, you have this potential and let's nurture that. And so the idea isn't that, okay, you've got that, just kind of live with it or make the best of it and try to find a gift in it. There you go. It's
Mm-hmm.
like, oh, here's what you're presenting. Here's what you have that has a potential gift. Let's mold that. Let's hone that. And
Mm-hmm.
and westernized culture is so the opposite of that, has no context for that at all, as far as I can see, or barely any, if any. That, the only kind of help we usually think of getting is like, how do we make it go away so that you're back to normal?
Yeah.
And right, so um,
Yeah, it's so true. And what's really profound about what you just said is that you're not pretending that it's an easy path and everything's full of flowers and roses. You're actually you're honoring both the fact that there needs to be some support, but also honoring the fact that what is the gift.
Mm-hmm. What is the gift? Yeah.
And yeah, that's a really, so when you're working with people, is that the context that you come from when you're addressing mental health?
Yes, yeah. So, for example, in bringing it down to a practical level of a patient setting, where someone comes in with anxiety or someone comes in with depression, and occasionally I do see people with bipolar, and that is the context. It's like, okay, first of all, I don't use these words necessarily, but first of all, let's normalize this feeling that you're going through, right?
Mm-hmm.
Oftentimes when people are struggling with something, especially a mental health issue, there's a lot of guilt, or they feel like, oh God, how come I can't cope? And I think as a practitioner, as a clinician, and just as a fellow human being, one of the most important things to start with is like, first of all, it's okay that you're feeling this way.
Mm-hmm.
Like this is an absolutely okay way to feel and an okay way to be. And my biggest concern always is, of course, the risks that come with, a low mood or different perceptions. Is we're always worried about suicide in mental health, right? And so, of course, those are always things that we want to explore, because safety first. First do no harm. I'm trying to determine, okay, is this person in such a state that are they in so much pain that they would that they would make a judgment to take their own life, and that's
Mm-hmm.
or hurt someone else. That's always a baseline. And the reason I ask that and I frame it in that way is because I feel, and I've felt that I've felt that low, that I've seriously considered it, and I think it's a kind of
Mm-hmm.
pain that is really a calling to like not be this way, like not to change. It's something,
Mm-hmm.
something in us has to die for us to have the transformation, through this process. But in the practical sense, in a clinical sense, you're making sure someone is safe, and if they have a suicide plan, you're doing the things that keep them safe from that, including considering,
Sure.
admitting them to stabilize them mood wise, right? So that's a hard line. That's one of the hard lines, right? Is like, and in fact, I've shared this in a way of like, this is a really difficult process, and there's pain, and there's
Mm-hmm.
something to be gained from it. But I have faith
Mm-hmm.
that you and I and your support team, you can come through this and come out. You can have a transformation through this process, and you just have to stay on this side of life, right?
Mm-hmm.
Like, stay on this side as much as just like everything you can do to hang on this side, and then let's do the things that help you feel more comfortable through the process. Whether it's, and absolutely it's, is your diet a factor? Do you have a food sensitivity? Are you not getting enough protein? Are you just not getting the nutrients you need so that your brain can function through this process optimally? Do you need botanicals? Do you need amino acids? Do you need a psychiatric med? This doesn't exclude that range. So let's find the formula that works for you. And then the other support, like, do you need a therapist? Do you need a group? Let's shepherd you through this process. And let's always keep in mind, like, the perspective isn't that like you're sick. There's people who would like to make the analogy that, well, why would you be ashamed about taking insulin as a diabetic? In the same way, you shouldn't be ashamed of taking medication. And I love that, because it destigmatizes it from a medical perspective.
Right.
And the field of psychiatry is not as actually firmly grounded in physiology. At least the physiology of psychopharmacology isn't as clearly, it's not as black and white as insulin to diabetes, as you know.
Right. And yeah, and the social aspects, although the social aspects of any chronic illness needs to be recognized, the level of social impact for someone with a mental health problem is at a very high level.
Mm-hmm.
Wonder if you could comment on sort of the difference of someone who's been given a mental health diagnosis. And I think you referred to something when we were talking offline about best prognosis or better prognosis theory. I think that's what it's called.
Right.
And if you could just talk about that, because I think it really impacts the social impact of being given a mental health diagnosis.
Yeah, that's a really thanks for bringing that up. So the better prognosis hypothesis is the idea that people who are diagnosed with, and this specifically refers to people who are diagnosed with schizophrenia, psychosis, or bipolar, sort of the more extreme end of non-ordinary states. So it seems that people who are schizophrenic, bipolar, and so on, and are diagnosed and live in developing countries fare better over the long term than people who are diagnosed in Western industrial countries. And there's even an interesting study which is sort of related to this, but or might be part of the reason, is in, for example, in countries like India is one that I recall. You know, it's more common for people to have visions and voices that are encouraging and are advising, versus in the Western sample set of people who hear voices, they're more often tend to be aggressive or critical or mean. Mm-hmm. So, you know, there's obviously a social context that may be happening here, and that's starting to be borne out by more and more research. So is it because the psychiatric or the antipsychotics we use are actually making people worse? Is it that many psychotic, so-called psychotic or schizophrenic instances are naturally self-limiting? And if you give people a context and a space and the support to work through the process, they will actually come out of it on their own, and will not have needed that. And that's the same argument that has been made for depression as well. For example, there's some good evidence that people who take antidepressant medications are more likely to have a relapse in their depression down the line versus people not. Now, you know, there's a long conversation about, well, what's the sample size and what are the parameters? But bottom line being, how are we supporting people, you know, who are having these experiences? And let's not ignore the fact that, you know, the US is such an individualistic society. It leaves many people really without any social support, and that often goes down, you know, racial lines, social economic lines. And so there's sort of this layering of factors in which someone who's both their family trauma, their socioeconomic status, their lived experience in the world, their nutritional status, you know, all these things can contribute to them having a non-ordinary experience, right? Some kind of so-called break with everyone else's reality. And it's these people who are in that state, you know, people of color, people who are poor, are less likely to have the support and the time. I mean, think about very wealthy people who might have these very unusual states, and they might, you know, get the opportunity and the benefit of being called eccentric, right? Because they actually don't have to work to make a living, and so their family can sort of support them and take care of them and possibly help them see it through. You know, if they have both the wealth and the emotional understanding of their community, then probably they can get through it and then just go on to be this very creative person, possibly.
Yeah, I think I've seen all aspects personally. I've seen wealthy people with mental health disorders get rejected by their family.
Right.
And I've also seen in poor parts of the world or poor communities where someone with a mental health disorder isn't treated different, and they're kind of included in all family activities. They're just there, just like everybody else, and everybody loves them just like everybody else. So I've seen these examples. So what you're saying is really profound, and I don't spend enough time personally considering this in my own life and also in my clinical encounters. I think it's really eye-opening. And you brought up a term, neurodiversity, which I'm going to put some of these definitions in the show notes so that we all can have a context and understanding what these terms mean. But we talked just about neurodiversity, and I would also like, if possible, to share some of the opponents of neurodiversity and maybe shed some light on why there might be some opposition.
That's a really good question. Yeah, and I'm glad you brought that up because, for example, I've heard some communities, for example, in the autism community, even push back against the neurodiversity issue because they think it sort of romanticizes what actually can happen in people with severe autism. Like there's pushback against like the Rain Man example or the autistic savant model where, yeah, they're autistic, but they're also like really, really gifted and they may be a genius in a certain regard, when that can be really painful for families who have children whose symptoms are so severe, for they're deeply nonverbal, they're very, very emotionally labile, and it's a real struggle for these parents, they may feel excluded by the idea of like, oh, let's just accept people who are autistic and not try to change them because let's let them be who they are, when really there are cases in which they need support. And it kind of pulls back into like the social context of like, if productivity is your only measurement, if conformity is of greatest value, then yeah, it's a real struggle for these parents. And, not to mention, let's not forget like the economic toll, right? If I'm a parent and I have a child who needs so much care and attention and never progresses towards the independence that we expect of children, then that's a big impact on me. So that's one aspect of pushback against neurodiversity. And another piece is really just like society pushes back against neurodiversity, right? Let's face it, like the DSM is a catalog of the ways in which you are not functioning. The Diagnostic and Statistical Manual of Psychiatry is the ways in which someone is not functioning. So that's sort of the antithesis of neurodiversity. So those are the two examples that come to mind for me.
Yeah, and it seems, I think the concept of neurodiversity is that there are variants in our population of all kinds of, there's a continuum of behavioral variants and neurologic variants. And to take a step back and look at this from a perspective of a continuum versus something that, every symptom that someone who has, say, autism or Asperger's is a symptom that needs to be changed or corrected. That's sort of the Western view or conventional view, versus a neurodiverse view is to kind of be more respectful of the variants of neurologic tendencies or behaviors, and honor these differences versus think every of these behaviors needs to be changed. One of the examples is, for example, eye contact in an ADHD. I'm sorry, in an autistic person. Trying to change that, is that necessarily something that should be focused on?
Right.
So, yeah. I'm sorry. Were you going to comment on that?
No. It's that's. I was just agreeing with you.
Yeah, so I think this is a very important kind of topic for us to reflect on as healthcare practitioners, or anybody that's dealing with a mental health problem, or someone who has a loved one that's dealing with a mental health problem. And what if you were listening to this and say you had never heard these approaches, and it sort of stirred something within you, what could someone do with this new information? And for example, if they were to come to see you, or could you tell us some resources to learn more about this approach?
To learn more about, let's say, neurodiversity, you can simply Google neurodiversity, and all kinds of things are going to come up around it. There's conferences that are being held on neurodiversity. The film Crazy Wise is a really good starting point, because it's it follows the lives of a couple of people who were diagnosed bipolar and schizophrenia, and how they were both eventually able to channel that, but the trauma that they went through in the mental health system in the meantime. It also talks about some of the tribal and non-Western cultures that supports us. So that's a good starting point. From a clinical perspective, if someone were to come to me in a clinical setting, of course we would kind of explore these things and get them the support they need. But if someone wanted to learn more, I would suggest the names of Phil Borges. I would suggest the names of Gabor Mate, who talks a lot about, the influence of trauma on someone's being and someone's mental state and someone's emotional state. And Gabor Mate is, of course, a legend in these circles. And one of the things he challenges is really like, what is normal? What is it that we consider normal, and what do we consider abnormal? And, what are the reasons behind that? Is our society as a whole a sane society? What are we doing? Let's look at, you look at the environment, and you look at, the inequality is this what we consider normal? Our colleague, Brad Lichtenstein, said a while ago, and this has always stuck with me, he said, why are people who are depressed and anxious in this difficult world, why are they considered abnormal or ill? And why do we?
Yeah. I've heard the term, how could you not be depressed or anxious?
Yeah.
Right.
Yeah. But the interesting follow-up he had to that was, and how come we don't pathologize greed, or avarice, the obsession with money, and,
right.
and power? Why do we not look at that as pathological? It says so much about our society, the things that we call normal and the things that we accept as normal and abnormal. So really, even just questioning the labels of what we put, is a really great starting point for someone who's listening, or whoever approaches me, that is wondering about themselves or a friend of theirs or a loved one who is not falling into the quote unquote, normal ranges of what society seems to think they should be. Sure, there could be a strong element of, can we help them be more comfortable and be their best selves through nutrition and through the right kind of medicine and the right kind of support? Absolutely, we're not excluding that or saying no to that. And the gift, the gift in what they have. Let's not forget that, Let's not exclude that when we take the catalog of all their qualities and all their behaviors and all their characteristics. Let's not just look for the ways in which they're not functioning. Let's look for the things they have in which, if we could support them enough, if we could make them feel safe enough, they could actually make our community better. They could contribute. They could even be leaders or healers.
Amazing. Well, I'd like to wrap up on that note. That was very profound. I'm just deeply honored to have had this conversation with you, Dr. Teray. And thank you for coming on today.
Thank you so much for having me. It's been a pleasure.
Okay. We'll talk to you soon, I hope. Thanks. Take care.
Okay. Bye.
Hey, everybody. This is Dr. Rindy. I'm just sharing some concluding thoughts on the episode that we just listened to with Dr. Teray, Garchitorena, Kunishi. I'm not going to dive too much into adding additional information from the episode. I just want to highlight a few things that I think are really important. One is to really look into the topic of neurodiversity. Judy Singer, who coined the term in Australia in 1988, is someone I would look into, and also Harvey Bloom, who popularized the word in the Atlantic issue in 1998 with an article on neurodiversity, may give some more context of this term. I think personally, this affected me on a deep level because, I've been a father of a medical child, and one episode I might go into further details about that. But just listening to this episode stirred some emotions in me because I realized that my son, was getting a lot of different labels and diagnosis based on his medical bout with pediatric cancer, and the trauma that was associated with that particular treatment and that particular process. He also was a dialysis patient because of cancer therapies, and the trauma that he experienced really added a number of layers to how he was being described by the medical providers. And I can see on one hand how it's really important to take a diagnosis seriously, so that there's tools and resources and medications available to help increase the outcomes and improve the ability to manage these mental health conditions. On the other hand, in certain people, it may be limiting, especially in younger folks who, with a neurodiverse perspective, may develop better self-esteem versus being seen as outcasts to society. So, and they may have better, more favorable outcomes with their life if the context of neurodiversity is incorporated in their early approach. So I think this has a really big place in the mental health world. On the other hand, I can also see how someone who has a very severe diagnosis of a mental health problem would look at this as potentially trying to downplay the severity of what one deals with a severe case of schizophrenia or bipolar or any mental health problem for that matter. There's all degrees. Someone who says they have condition X means a completely different thing. You have to really know the inner workings of how that condition is affecting the social support structures, the severity of the condition, before you can determine whether this is someone who would really be considered supported by a neurodiverse approach, or if that would potentially water down the severity of the medical implications of their condition. So I think this is a very important topic and can really improve the lives of others that are dealing with mental health problems, and for all of our loved ones and those listeners who are struggling with mental health conditions. This is something to look into, is kind of learning about the strengths of having neuroatypical behavior, or something that's not considered to be mainstream behavior, and to work with someone that could potentially be a guide to help the understanding. So this opens some possibilities, and I hope you enjoyed the episode. And like I said, it was a very emotional, intense episode for me, but I'm really glad we did this episode, and I hope it helps the lives of the listeners and your loved ones. So please continue to listen to our episodes. We have a number of episodes already recorded, some really great topics coming up. I'd love for you to subscribe in iTunes. Look for the One Thing podcast by Dr. Adam Rindy. In iTunes, we're in Stitcher as well. We're in pretty much all the major players, Spotify. Go ahead and subscribe so that you get the episodes when they launch. And please share the episodes with your friends and loved ones. We really want to get this information out there. This is a labor of love for me, and I'm really enjoying doing this, and I hope you're enjoying the episodes as well. Thanks again for tuning in to One Thing.